It's working? Yanis Mamiledzis, WHO Ukraine Country Office. Thank you very much for this wonderful session, and really wonderful to see the incredible work, Herculean work done by our colleagues at the Alliance for Public Health. And I think just to comment that this session is both inspiring and depressing when you're also showcasing, Tanya, the kind of the erosion of the ability for civil society to be able to do its work in countries in the region. I think one of the positives is, in Ukraine, I think we have, even though we always want to improve our collaboration across sectors, UN partners, donors, government, local government, and NGOs, I think it's just a testament to this collaborative approach on prevention, which I think is making sort of putting the backstops to HIV transmission, despite, with all the gains that have been made over the past few years. I have a question sort of related to your thoughts, I think to both the colleagues from the Alliance for Public Health on decriminalization. I know we're focusing on expansion on OAMT, and tomorrow we have a session as well on OAMT, and our colleague from Ukrainian Public Health Center is here as well. And so sort of in that sort of process of trying to expand low threshold OAMT, looking to bring in sort of other formulations such as long-acting injectable buprenorphine, how does this all fit into maybe the, whether this big event, the full-scale invasion of Ukraine by the Russian Federation and invasion of public health in the region, whether we have an opportunity really to move the discussion on decriminalization in Ukraine forward and how that can happen. Thank you.
Thank you very much, Yanis, and a lot of appreciation to the work that WHO and yourself in the time of war do in Ukraine and your solidarity and support. In the grim situation in the region, I would like to comment on that a little bit. At the same time, I think it reinforces the need to maintain the dialogue in the region, to keep up working with the networks that we have worked with the civil society, with the governments, and keep on offering alternatives and showing some of the better practices and potential developments in response. So I think although the situation looks grim, it is so important to maintain this dialogue and keep moving, because the time will come when the region will flourish. Absolutely, the long overdue reform and criminalization of personal use in Ukraine must happen. And I really applaud the development that occurred on medical cannabis, and it's been facilitated maybe by kind of the discussion among the military people and pain-killing options there. But I think it is also this big event will eventually lead to long overdue criminalization of personal possession in Ukraine. In Ukraine, this has not been enforced so actively as in some of the countries in the region, so we have not seen such a harsh and broad criminalization and the kind of police activity. But at the same time, this must change, and I'm pretty sure we will be seeing this development in the next year or so. I'm also optimistic that the national drug policy, drug strategy is being developed, and although it is still, there are some steps backward, forward and backward, but I am sure this should be one of the core milestones put into this strategy. We must make it happen. That this is so long overdue and must change. Thank you.
I can see another question on the floor. Do we have a microphone?
Hi, great seeing so many great colleagues here. Pedro Mateo Jalabert, School of Public Health. Hi, David, you're in New York. I've been testing SAM pictures, all of you. Extraordinary work. I'm very, very curious about how big events in the case of Ukraine, so wonderfully presented, has so much impact on policy that seems somehow unrelated to the war, specifically what you have presented regarding the quote-unquote questioning of the harm reduction practices, and also very interestingly, and not obviously related, the LGBTQ. So I wonder what are your thoughts regarding if and how and why the big event of the war in Ukraine has those parallel tracks between attacking harm reduction, preventing other countries to engage in funding some of those practices, and then the LGBTQ narrative, again, is not an obvious connection, but you have made a great point that it is happening. Again, great panel, thank you.
Thank you very much for your question. So I think indeed this is some of the feature of autocratic regimes to try to control personal behaviors and personal choices as much as possible. So this is related to choices of your sexual behaviors or your choices for substance use. And so trying to limit and to control this freedom as much as possible. This is indeed one of the critical features of autocratic regimes. And in this time of crisis, we have seen how this has become even stronger and even more severe in a sense. So Russia trying to what it has done inside its country. It is trying to broaden its policies to other countries in the region and to exercise control, not only in military or economic or kind of cultural sphere, but very aggressively in public health sphere. Unfortunately, we have seen this happening for many years, but even before the war. But the war has made such a strong push to this autocratic healthcare, autocratic policies becoming so much stronger and much more evident. And unfortunately, we are seeing the impacts on the epidemics already. I have given just some of the top-level figures on new HIV infections, and we are seeing that they keep on happening. And unfortunately, we will be seeing the situation worsening further on.
Maybe time for one more question? Is there anybody? In that case, I'm just going to ask one quick question of Magdalena. Has it been possible to evaluate the effectiveness of the extended benefits themselves rather than the extension of the extended benefits? Any impacts of those on overdose?
Yeah, so that is exactly what we were trying to do, is look at, by leveraging differences in timing of start and ending of these benefits, trying to figure out, did these extended benefits have an effect on overdose deaths? Based on what we found, they don't seem to have had an effect. But we also have just looked at them in isolation of all of the other policies. And so what I wonder if it is that maybe, just extending unemployment benefits for 13 or 20 weeks is not enough, and you have to do that in addition to many other, raising minimum wage, income support, income supplements, in order
overthrowing capitalism, etc., etc.
Yeah. Basically protecting a lot of the social needs, right, that people have in order to have an effect. So that's the next piece in our work, is really trying to figure out what are all the key elements of economic support policies that you need to put in place.
Would that be like mathematical modeling or something like that, or how?
I think there is a role for mathematical modeling, absolutely. As well as, just what we're trying to do is mapping all of these policies, when they started, when they ended, who implemented them, so as to be able to identify what the policy packages are and seeing if we can evaluate them. It's actually a really tricky thing because you may not have a good comparison group, right? Especially when all states have implemented certain policies. So that's what we're really trying to figure out. Can we identify policy packages where we actually have a good comparison group? And in that case, if we don't, then modeling is a useful tool.
Yeah. Fantastic.
Wrap it up? Yeah. So that's time. So I'd like to thank all of the speakers. Very interesting session. And we now have drinks and a welcome reception outside. So can you join me in thanking our speakers one last time? Thank you.